Thanks for joining us today, Charlotte. What are the current health measures in place and how do the isolation centers operate?
Hi, Brittany. So since March 18th, the government of the Northwest Territories has made 14-day isolation mandatory for anyone entering the territory who's a non-essential person. And we have 4 isolation hubs in the N.W.T, Yellowknife, Fort Smith, Hay River, and Inuvik. So anyone coming in needs to isolate there. So that's been ongoing since the entirety of the pandemic, really. And the COVID Secretariat, which is a new department created in pandemic response by the N.W.T, they've created a feedback report on how they think they're doing, getting feedback from Indigenous governments, communities, stakeholders, businesses, and that's really what's moving us forward to understand how people are feeling about this self-isolation.
Now, what highlights did you see from this feedback report published?
Yes, so much of the feedback was centered around the cost of isolation if you cannot self-isolate, if you're at one of the isolation hubs. And communities and Indigenous governments are really concerned about the cost it's costing taxpayers. Currently, it's about $4,000 per person for 2 weeks to stay at one of the isolation hubs. And the N.W.T has spent more than half of their budget that was budgeted for health measures for the pandemic response. So a lot of Indigenous governments and communities are really urging the government to explore the option of allowing community members to be able to self-isolate in their own community. Now, how that would play out is still uncertain, and the report really was divided on what measures should be taken to ensure that there's equitable access to self-isolation. If communities are unable to physically distance, would they be on the hook then to stay at one of the isolation hubs? Reducing taxpayer dollars that are going towards the isolation hubs has raised the question of whether or not we should be paying for individuals who go down south for, say, vacation or non-essential travel. So Indigenous governments and communities are still on the fence on what the government should be doing to reduce costs and how that would roll out, but there certainly is a push for community members to be able to go back home and not have to isolate in one of the hubs.
We just have a bit of time left, so just to end off here, what will the government do with this feedback?
So this was really one of the first reports of its kind since the creation of the COVID Secretariat Department. Now, the Premier and our Chief Medical Health Officer, Dr. Cami Candola, have both been very adamant that they are against travel over the holiday season. They're really urging, community members not to be going down south. And they also have been saying that they're in conversation with the federal government on vaccination rollout because the N.W.T has a high Indigenous population. We are a priority for vaccination. Whether or not we'll get that in the spring is another question. So right now it's kind of at a standstill on how the government will respond now that they have this feedback.
Okay, thanks for that, Charlotte. That's all the time that we have today.
Thank you.